Hi, everybody. Kathy Braxton. I'm on Reddit as Dementia Whisperer, and this is your YouTube channel called Dementia Demos. And today I saw a dementia or a Reddit post about aggression, specifically in the nursing home, and the question about what do we do? Because that's where she's supposed to be when she's more aggressive, is because we can't take care of her, right? That's what they're for. Okay, great, really great points. I want you to think about it in a couple different ways. Absolutely, that's what long-term care is actually about, specifically for memory care, is that they're supposed to be more of the experts in managing this type of stuff than most people can handle at home, right? And the number one thing is safety. So what they're going to do always is they're going to assess the safety of your loved one, your resident, and then the residents around them. There should always be a way to work this problem out. It is very rare. And in my 28 years, I have had maybe 3 instances where I've had a resident that was displaying so much physical aggression that it put the other residents at risk, regardless of any other interventions we did. And we had to help the family find a new placement for them. But again, I'm saying 28 years and maybe 3 residents in total. So in this day and age, I imagine that facilities should be a lot more wiser to what they're managing and how to manage it and to work through some different interventions. So my question is, have they invited you to a care plan meeting to talk about what kind of aggression they're seeing, when they're seeing it? Have they established any patterns? These are great questions for you to ask too. Hey, call them up. Be like, I want to have a meeting about this. Be proactive about that. That's definitely going to show the facility that you want this to work out and that you're going to be a care partner with them. When it comes to patterns, I'm sure you've read in some of the posts and different things you probably already know. UTIs are a huge exacerbator of people's behaviors if someone's having an infection. So make sure the facility has ruled that out. I am sure they have. I'm sure they're wise to this. Also, look at the sleep that they're getting. Are we seeing an exacerbation of behaviors because a medication has been changed, a medication has been added? What's happening in the physical environment, right? Are we seeing a pattern into a time that stuff's happening or towards a specific type of person? Is it another resident that's triggering them? Is it a caregiver? This is, I see more often than not, I will say in 27 years, this is the repetitive pattern I find. UTIs, changes in medications, absence of sleep, but more often than not, it's caregiver interactions. What is happening? What is causing this kind of conflict? Because yesterday I worked with a resident who was all up in arms and upset about things. Took me 6 hours until, and I'm saying I worked with her intermittently through that time, 6 hours of working with her, meeting with her, sitting in an office with her, until the very last hour where she said something where it all clicked and it made sense. So it was like a really slow play, right? But she was making sense. Everything she was worked up about all day long, when it came down to the end of the day and I was able to tie it together because of one special thing she said, it all made perfect sense. And it usually does. So the emotion gets carried throughout the day. How did it get triggered though? What triggered it? What started it? Again, advocate for having a care plan meeting. If you can't be there in person, do it online or on the phone or in Zoom. Ask them what interventions they have tried and what patterns have they seen. And then share with them what you know of your loved one. Is there something that has always triggered them to be upset? Maybe this is the key that they need. And then oftentimes there are interventions we can put into place, maybe switching up rooms, location of room. Maybe they need to sit in a different space during mealtime. So what interventions have they put in place already? What other things are they willing to try? Ask them that. What other things are they willing to try before we start looking at moving mom or dad to a completely different facility? And would it even be reasonable to consider sending them on they call it a short-term stay to kind of re-regulate their medications? So these are all things you can talk about before you start to go down the road of having to find a brand new place for mom or dad, right? You be the advocate, ask smart questions, look at patterns, and consider personal interactions as a huge trigger. I am hoping that this helped you. If you need more, please reach out or make a comment on this video. Again, this is the YouTube channel for Dementia Demos, where I answer questions that are posted on Reddit. My Reddit username is r/Dementia Whisperer. Good luck.